Welcome. My name is Dr. Ammitai Worob. Today we're going to be talking about headaches, both treatment and prevention. This is the third week in a row now that we're trying this. Not last week, but the week before, I got out in front of the camera here and I was dropping pearls. It was the best 10 minutes you would ever want to spend in your life, and it didn't get recorded. We had technical problems. So last week, I got in front of the camera again, and somehow I even topped the first week in terms of, dropping pearls of wisdom. And it was just, it was the best 10 minutes of your life that you'd ever spent, even if you had been on the previous week. And now, here we are in the third week because that one didn't work either, but I think it's actually working now. I think it's working. So if you're out there, wave and say hi. So what we were going to talk about, and now that hopefully we've resolved our technical issues and we have beautiful Ithaca here in the background, this is actually right outside our office, although it's not quite as lush and green as this yet, but we're getting there. We're getting there. We're getting there fast because we went from snow on Sunday to 80 degrees Monday or Tuesday, I guess it was. I think it was Monday. So back to the matter at hand. Headaches, they're awful. I know that when I get a headache, I'm kind of like not happy. I'm way less productive. I can't concentrate because I'm thinking about my headache, or it's just hard to, move, concentrate without it getting worse. Let alone a migraine, which again, thankfully I only get those maybe once every couple of years, but they're totally debilitating. So when I have people come into our office with headaches a couple times a week, or migraines, a couple times a month or more for 5, 10, 20, 25 years, I am astounded that people can even function because they're so debilitating and they are a scourge of modern society. And in terms of the causes of headaches, they are myriad. There's lots of different causes of headaches. There can be physical, neurobiomechanical problems, and that has a lot to do with texting, using devices. Here's my swiping down at the bottom, but you can't see that here. Keeping our head down all the time on our electronic devices, and we are in a flexion-addicted society where we're always coming forward, our head's always coming forward. And that places a tremendous amount of strain on the muscles that hold our head up and keep us from flopping. So there can be a physical stress problem. There can be a biochemical stress problem. There's some people that come in and they have migraines 1-2 times a week, and they come in, they get great results, and now it's just down to like 1-2 times a month, but it's the same time of the month every month because there's a hormonal issue, and that's where being able to identify that and refer to the appropriate provider to address that can really get to the underlying cause. And then there's, of course, emotional stress. So psychological stress, emotional stress, which also, of course, manifests physically as well. So there's lots of different causes of headaches. And if we can identify the causes of them, it's easier to treat and therefore prevent those headaches from occurring in the future. So in terms of identifying those things, that's really what we specialize in here. And that's why I love working with people with headaches and migraines. Not that I love that you have them, but people who come in with headaches and migraines, I would say more than any other condition or population, I see the miracles happen all the time where people get their lives back, whether it's a woman who's been having migraines weekly or more for 25 years and then comes in and 3 months later hasn't had a migraine, and 3 months after that has lost 35 pounds. Not that I have a weight loss program that I sell here at the office or run here at the office, but because she wasn't having headaches and migraines, she was able to get back to being active, started doing Zumba classes, body pump, etc., and lost weight, and she was more active than she'd been in 40 years. Same thing with somebody who had to go out of work on disability because of migraines and was able to return to work several years afterwards, which is kind of unheard of. After you've been out of work on disability for a few years, it's pretty much, if you've been out of work for 3 to 5 years, probably not going back. And now he's back to being able to not just support and contribute monetarily to his family, but his self-esteem is so much better, let alone the activity he can do with his family and going on vacations, being able to enjoy travel. So, when we see people with headaches and migraines, I get very excited because these are the people that I know we can really help out. So in terms of treating headaches, well, again, there's lots of, if there's a physical cause, if there's a problem in the way that your neck is moving that's causing headaches, if there's a way that your head sits on your neck, if there's a way that your cranial bones line up, these are things that we look at in this office. And one thing that really is special about our office is the higher level of diagnostic training that we have in terms of radiology and imaging. I'm the only MRI interpretation certified chiropractor in town, and we do a certain study, a cervical motion study, X-ray, that really we can pinpoint where the cause is to correct the cause. And again, it's kind of using that same model that we use in dentistry is find the problem, fix the problem, figure out ways to stop recreating the problem. There's, again, proper diagnosis will then lead to the proper treatment and then the proper methods of prevention. Again, if there's a biochemical issue, we're going to want to address that. Some of that stuff we can do here in-house because both myself and Dr. Carapella have advanced training in clinical nutrition. Again, if it's a hormonal issue where a topical progesterone, or maybe there's a thyroid issue where medication needs to be prescribed, well, we can refer to the appropriate physicians, and that's another thing that we really pride ourselves on. Or again, good diagnosis so that we can do what we do best and then refer out to other excellent providers to do what they do best so that the patient gets well. And then, preventing, it could be as simple as your ergonomics at your desk. And that's something that we also do in the community is go out and do ergonomic assessments in the workplace, at schools, so that, I can give a great adjustment, clear motion in your neck, decrease spasm and irritation to the nerves and the muscles in your neck that cause headaches. But if you go back to work and you're like this, it's just going to be a problem all over again. So being able to, again, identify the underlying cause so that we can correct it and prevent it going forward. So that's another thing that we're going to look at is, what are the factors that are leading up to this? Could be diet, could be the way our desk is set up, could be a lot of our lifestyle stuff. A lot of us benefit, everyone benefits from meditation, but some of us really need it because if we don't do it, we're not going to be able to decrease our stress load. And this is a conversation that we just had here earlier in the office today was what, this person has a lot of stress in their life. What are they doing to be able to adapt to those stresses? And the things that we know that help are things like meditation, exercise, getting body work like massage, acupuncture can be really helpful. Chiropractic can be really helpful in evening out the tone of the nervous system. So, again, in terms of headaches, treatment, and prevention, the first thing is properly diagnosing, and that's what we really pride ourselves on here, and then delivering excellent care, and then figuring out a way to stop recreating the problem going forward. So I'll look forward. I hope this one recorded. You'll see me looking past the camera because I need to see, is this working and how do I turn this off? Oh man, I don't even know what I'm doing. So now I can't even see myself over there. So I don't even know how this is going to end, but I'm going to try to end it here. And I appreciate you watching, and I hope you got something out of this. I would love to hear your questions. Oh, I think I just shut it off.